Welcome back. It is time to enroll in Medicare prescription drug plans known as Part D, and it's important to make some informed decisions. And we have people here today who can help. You can call our Medicare Part D phone bank today for the rest of this hour until 1 o'clock at 859-294-6090. We have representatives standing by to take your calls. And right now I'm joined in our studio by Angela Zeke, a paralegal and SHIP coordinator with Legal Aid of the Bluegrass, and also Bob Foster from the Centers for Medicare and Medicaid Services in Atlanta, who's been joining us here today. Thank you both so much for being with us.
Thanks for having us.
Well, this is an important time for enrollment, and there are some things that are a little bit different this year that you definitely want to make folks aware of if they need to enroll, right?
There are. I mean, the plans change a little bit every year, and we always want people to pay attention to what they've been in and how it may be changing for the next year. But our big change this year is the dates of the open season that everybody has. It's already started this year. It's October 15th was the beginning date, but this year it's also ending earlier. On December 7th, Congress has tried to move it a little bit out of the holidays, which hopefully will get people's attention better. But we don't want them to wait until after December 7th because that's the closing date.
And you mentioned the plans. That's always something to consider based on your own medications, the treatments and therapies that you're currently on to kind of see what works for you?
Right. I mean, how many medications are you taking? Are you in regular Medicare, or have you gone into one of the health plans for your coverage of Medicare? Did you get the prescription coverage or not? If you have the prescription coverage, you know, how many prescriptions are you on? How expensive are they? What kind of plan covers them best? And that's something that the SHIP is really good at helping them with. We have a program, a very elaborate program on our website that people can use themselves, or if they need help, that's why we have the SHIP that works with us in every state.
And what are some of the ways that you're able to assist folks with understanding the plans and also maybe even some additional help that they can get?
We do what we call a drug plan comparison using the tool designed by Medicare to evaluate not only premiums but deductibles and how much they're going to pay at the pharmacy. We have open enrollment events that we've scheduled throughout Central Kentucky, and by going to the website, individuals can see where we're going to be and what date we're going to be there. Or they can contact their local SHIP program and meet with representatives of the SHIP, whether it be staff or volunteers throughout the region, and we can provide that assistance.
And we've been running the phone number for our phone bank that's open right now, 294-6090. And you'll also see two websites at the bottom of your screen for Medicare services and also for the Legal Aid of the Bluegrass website that Angela mentioned, where you can get more details on their events. And I'm sure it's one of those things that folks just really need to get the information to make their decisions. And if they don't, they can get in a little bit of trouble.
They can. It can be a sticker shock when they go to the pharmacy in January. So it's best to compare during the open enrollment period. Also, when they contact their SHIP program, we're also going to screen them for other money-saving benefits to see if they're getting everything that they should. Assistance to pay for the Part B premium, assistance at the grocery store, assistance to pay on their drug plan premium and reduce those costs at the pharmacy. So it's very important. Get in touch with SHIP and allow us to evaluate those plans and also screen for other benefits.
And as Bob mentioned, you got to move things up a few weeks. Don't wait until the holiday season gets here.
Don't let it go by. Don't let it go by. And I know you've had the websites on the screen. The website for Medicare is actually medicare.gov. We have a cms.gov website, which is primarily for professionals, to the doctors and the nurses and the hospital administrators, and has a lot of information for them. But the tool that Angela mentioned is on our medicare.gov website, and actually people can go there themselves and use it if they're comfortable with the Internet.
Great. Well, thank you so much for mentioning that. Thank you both for being with us.
Thanks.
Again, you can continue to call until 1 o'clock, 294-6090. We'll be right back.